Hello, this is Dr. Ashok, sexologist from International Center of Sexology Research and Development, HANUMAN Junction, KRISHNA District, Andhra Pradesh, India. Let's discuss today about premature ejaculation. We call this premature ejaculation in short as PE. Though various definitions in terms of timing, voluntary control, and partner satisfaction are taken into consideration, the most accepted definition of premature ejaculation is the persistent recurrent ejaculation with minimal sexual stimulation before, during, or shortly after penetration and earlier than the person wishes to have it. In older definitions, the duration of intercourse, number of pelvic thrusts, number of times the partner became orgasmic, and voluntary control of the man were mainly considered. The premature ejaculation is an extremely common sexual dysfunction. Studies have shown that 20 to 30% of people have this problem. It is said that it is as common as common cold is. Some men are not bothered if they ejaculate early. Some argue that when fastness and speed is a feature of masculinity, why the speed and quickness in ejaculation is considered a problem. Many men think that their masculinity is in question and they suffer from low esteem, frustration, and performance anxiety. Some men may eventually develop erectile dysfunction. Some female partners are understanding and accepting. Some become angry and feel being used. Some may avoid sex or seek other partners. Some may get a feeling that the partner is selfish. Experts say most men reach orgasm in less than 3 minutes, whereas most women need at least 10 minutes. Most of the time, early ejaculation or early orgasmic response is due to anxiety or hurry, which results in heightened arousal. It is very easily diagnosed by the patient's complaint and detailed history taking. Premature ejaculation rarely results from organic causes. It can result from early sexual experiences in which they have ejaculated fast. For example, during masturbation, fear of being discovered by others, hurried sex with a partner, commercial sex worker, group masturbation, etc. Some cases are said to be the result from castration anxiety and unresolved Oedipus complex. The premature ejaculation may be dysfunction developed as a conditioned or learned response. It is also very common during the newly married period. Premature ejaculation can occur temporarily if the man is tired, exhausted, depressed, having poor self esteem, fatigue, tension, illness, too much sex in too short a time, taking alcohol or drugs. Majority of adolescents and young adults begins as early ejaculators. Learning ejaculatory control involves identifying the point of ejaculatory inevitability. Typical lovemaking extends from 20 to 40 minutes, of which 2 to 10 minutes involve intercourse. Contrary to many myths, intercourse seldom lasts longer than 10 minutes. Feeling of orgasm begin at the point of ejaculatory inevitability and last 3 to 10 seconds. Couples participation is very important in treating premature ejaculation. Practicing the contraction of pubococcygeus muscle voluntarily at the time of ejaculator inevitability can prevent ejaculation, though pubococcygeus muscles contracts involuntarily to squeeze out the semen during ejaculation. Exercise the muscle, that is Kegel's exercises 3 to 5 times a day. Pressure on the soft space between scrotum and the anus is to stop the ejaculation because ejaculatory duct is said to be situated there. After vaginal containment by slow, erotic movements and not heavy, rapid thrusting. Change of position. Instead of missionary position, try women on the top or side positions. Do not focus on the highly erotic area of the partner in the beginning. Use of condoms to lessen penile sensation. Use of local anesthetic jellies on the penis to reduce sensations and slow the ejaculation. Sometimes these creams can cause irritation of the penile skin. Diverting the mind away from erotica during ejaculatory inevitability. Let's see the special techniques to control premature ejaculation. To understand these techniques, one must understand what happens in his body when he ejaculates. Orgasm consists of two stages. The first stage occurs when prostate contracts and releases its fluids along with contents of seminal vesicle into the urethra. Second stage occurs when pelvic muscles contract around the bulb and force the fluid out under pressure through the urethra. Men can ejaculate without having orgasm and vice versa. Orgasm begins on the point of ejaculatory inevitability and lasts 3 to 10 seconds. Man has to be comfortable with his body and understand sensations and feelings. Comfort, awareness, and stimulation are important. Let's see stop and start technique. This can be tried during masturbation or during intercourse with the partner. The man signals the partner to stop stimulation as he is nearing the point of ejaculatory inevitability. Stop stimulation for 15 to 60 seconds until the need to ejaculate disappears. Then resume stimulation. By repeatedly doing this, he can postpone ejaculation and develop a control of himself. Realistic expectations, however, are important. Maintain ejaculatory control for 4 to 7 minutes during intercourse. Women's feelings are important. The man should take her to orgasm by manual, oral, rubbing, or vibrator stimulation. Sex need not end with ejaculation. Now let's see squeeze technique. When genital touching begins during the sexual act, the woman uses the squeeze technique periodically. The thumb is placed on the frenulum of the penis and her first and second fingers are placed just above and below the coronal ridge on the opposite side of the penis. A firm grasping pressure is applied for about 4 seconds and abruptly released. Pressure is applied from front to back and never from side to side. This technique reduces urgency to ejaculate. It must begin at early stages of sexual act and continue periodically every few minutes. It is not used at the time of ejaculatory inevitability. Only squeeze is done 3 to 6 times before penetration. After insertion, no thrusting is done for few seconds. Then slow movements get started. During intercourse, basilar squeeze can be used to control ejaculation. Thank you. Your Dr. Ashok. హాయ్ దిస్ ఇస్ డాక్టర్ అశోక్. శృంగారం పట్ల ఆసక్తి తగ్గిందా? అది మానసిక శారీరక సమస్యల్లో ఏదో ఒకటి కావచ్చు. సమస్య ఏదైనా పరిష్కారం ఉంది. మీ జీవితంలో శృంగారానికి సంబంధించి ఎదురయ్యే సందేహాలకు మా ఛానల్లో తప్పనిసరిగా ఆన్సర్ లభిస్తుంది. మీరు చేయాల్సిందల్లా మా ఛానల్ను సబ్స్క్రైబ్ చేయడమే. ఇక నేరుగా విషయంలోకి వెళ్ళిపోదాం.